Okay, this is the ATI Pharmacology Chapter 6, Anxiety and Trauma and Stress-Related Disorders. Anxiety disorders include generalized anxiety disorder, panic disorder, obsessive-compulsive disorder, agoraphobia, social anxiety disorder, separation anxiety disorder, and specific phobia. Trauma and stressor-related disorders include acute stress disorder and post-traumatic stress disorder. Persistent anxiety can become disabling and can require intervention with therapy, biofeedback, relaxation techniques, and the use of medications. Psychological manifestations of anxiety disorders can include fear and apprehension. Physical manifestations can include palpitations, tachycardia, and shortness of breath. Sedative hypnotic analytics, benzodiazepines. These are diazepam, lorazepam, clozapam, chlorodiazepoxide, clorazepam, and oxapam. These are your PAMs. PAMs and LAMs. Purpose, expected pharmacological action. Benzodiazepines enhance the inhibitory effects of gamma-aminobutyric acid, or GABA, in the CNS. Relief from anxiety occurs rapidly following administration. Short-term use recommended due to potential for dependence. Therapeutic uses: generalized anxiety disorder and panic disorder. Other uses for benzodiazepines: trauma and stressor-related disorders, acute stress disorder and post-traumatic stress disorder, hyperarousal manifestations of dissociative disorders, seizure disorders, insomnia, muscle spasms, alcohol withdrawal, induction of anesthesia, and amnesic prior to surgery or procedures. Complications: CNS depression, sedation, lightheadedness, ataxia, and decreased cognitive function. Client education: observe for CNS depression. Notify the provider if effects occur. Avoid activities that require alertness, like driving, operating heavy equipment or machinery. Avoid alcohol and other anti-anxiety medications due to potentiated depressant effects such as severe respiratory depression. Anterior grade amnesia, difficulty recalling events that occur after dosing. Client education: observe for manifestations. Notify the provider if effects occur. Toxicity: acute toxicity, oral toxicity, drowsiness, lethargy, confusion. IV toxicity can lead to respiratory depression, severe hypotension, or cardiac or respiratory arrest. Benzodiazepines for IV use include diazepam and lorazepam. Nursing actions: for oral toxicity, gastric lavage is used, followed by the administration of activated charcoal or saline cathartics. Administer flumazenil for benzodiazepine toxicity to counteract sedation and reverse adverse effects. Monitor vital signs, maintain patent airway, and provide fluids and maintain blood pressure. Have resuscitation equipment available. Client education: watch for manifestations, notify the provider. Paradoxical response: insomnia, excitation, euphoria, anxiety, and rage. Withdrawal effects include anxiety, insomnia, diaphoresis, tremors, lightheadedness, delirium, hypertension, muscle twitching, and seizures. Client education: withdrawal effects are not common with short-term use. If taking benzodiazepines regularly and in high doses, taper the dose over several weeks. Contraindications or precautions: warning, pregnancy, benzodiazepines are contraindicated. Lactation, benzodiazepines are contraindicated. Benzodiazepines are classified under Schedule 4 of the Controlled Substance Act. Benzodiazepines are contraindicated in clients who have sleep apnea, respiratory depression, or glaucoma. Use benzodiazepines cautiously in older adult clients and those who have liver disease, kidney impairment, or a history of substance use disorder. Benzodiazepines are generally used short-term due to risk for dependence. Interactions: CNS depressants, alcohol, barbiturates, and opioids can result in respiratory depression. Anticonvulsants and antihistamines can cause increased CNS depression. Client education. Avoid alcohol and other substances that can cause CNS depression. Grapefruit juice can reduce metabolism. Avoid the use of grapefruit juice. High-fat meals can reduce absorption. Do not take with fatty foods. Nursing administration. Administer the medication with meals or snacks if gastrointestinal upset occurs. Administer the medication at bedtime if possible due to sedation. Advise clients to swallow sustained release tablets and to avoid chewing or crushing the tablets. Client education. Do not take benzodiazepines in large amounts or more often than prescribed without consulting the provider. Dependency can develop during or after treatment. Notify the provider if indications of withdrawal occur. Store benzodiazepines in a secure place to prevent misuse by others. Atypical analytic and non-barbiturate analytic. The selective prototype is buspirone. The purpose is the exact anti-anxiety medication of this medication is unknown. The medication binds to serotonin and dopamine receptors. Dependency is much less likely than with other analytics, and the use of buspirone does not result in sedation or potentiate the effects of other CNS depressants. It carries no risk for misuse. The major disadvantage is that anti-anxiety effects develop slowly. Initial responses take a week and at least 2 to 4 weeks for it to reach its full effects. As a result of this pharmacological action, buspirone is taken on a scheduled basis and is not suitable for as-needed usage. Therapeutic uses: panic disorder, social anxiety disorder, obsessive-compulsive and other related disorders, trauma and stressor-related disorders, PTSD, GAD, and bruism. Complications: dizziness, nausea, headache, lightheadedness, and agitation. Client education: take with food to decrease nausea. Avoid activities that require alertness until effects are known. Most adverse effects are self-limiting. Increase fiber and fluid. For constipation and suicide ideations, monitor and report manifestations of depression and thoughts of suicide. Contraindications and precautions. Warning: buspirone safety is not established for pregnancy or lactation. Use buspirone cautiously in older adult clients and clients who have liver and/or renal dysfunction. Buspirone is contraindicated for concurrent use with MAOI antidepressants or for 14 days after MAOIs are discontinued. Hypertensive crisis can result. Interactions: erythromycin, ketoconazole, St. John's wort, and grapefruit juice can increase the effects of buspirone. Avoid the use of these antimicrobial agents. Avoid herbal preparations containing St. John's wort and SAM-E, which can increase the risk of serotonin syndrome. Avoid drinking grapefruit juice. Nursing administration: labeled for short-term treatment of anxiety but has shown therapeutic benefit as a long-term as a year. Client education: take the medication with meals to prevent gastric irritation. Effects do not occur immediately. It can take a week to notice the first therapeutic effects and 2 to 4 weeks for the full benefit. Take on a regular basis and not as needed. Tolerance, dependence, or withdrawal effects are not an issue with this medication. Selective serotonin reuptake inhibitors, or SSRI antidepressants, like paroxetine. Other medications are sertraline, citalopram, escitalopram, fluoxetine, and fluvoxamine. The purpose is expected pharmacological action. These medications are the first-line treatment for anxiety disorders. Paroxetine selectively inhibits serotonin reuptake, allowing more serotonin to stay at the junction of the neurons. It does not block uptake of dopamine or norepinephrine. The medication has long effective half-life. A time frame up to 4 weeks is necessary to produce therapeutic medication levels. Therapeutic uses for paroxetine: generalized anxiety disorder. Panic disorder decreases both the frequency and intensity of panic attacks and also prevents anticipatory anxiety about attacks. OCD reduces manifestations by increasing serotonin. SAD, trauma and stressor-related disorders, dissociative disorders, depressive disorders, and adjustment disorders. Sertraline, indicated for panic disorder, OCD, social anxiety disorder, and PTSD. Escitalopram, indicated for GAD and OCD. Fluoxetine, used for panic disorder, OCD, and PTSD. And fluvoxamine is used for OCD and social anxiety disorder. Complications. Early adverse effects. The first few days or weeks, there's nausea, diaphoresis, tremor, fatigue, and drowsiness. Report adverse effects to provider, take the medication as prescribed, and they should subside. Later adverse effects. After 5 to 6 weeks of therapy, insomnia, headache, and sexual dysfunction. This is impotence, delayed or absent orgasm, delayed or absent ejaculation, and decreased sexual interest. Client education. Report problems with sexual function. This is managed with dose reduction, medication holiday, and changing medications. Weight changes. Occurrence of weight loss early in therapy that can be followed by weight gain with long-term treatment. Nursing actions. Monitor the client's weight. Follow a well-balanced diet and exercise regularly. GI bleeding. Use caution in clients who have history of GI bleed or ulcers and in clients taking other medications that affect blood coagulation. Hyponatremia, more likely in older adult clients taking diuretics. Nursing actions. Obtain baseline blood sodium levels and monitor level periodically throughout treatment. Serotonin syndrome. Agitation, confusion, disorientation, difficulty concentrating, anxiety, hallucinations, myoclonus, which is spastic, jerky muscle contractions, hyperflexia, and coordination tremors, fever, diaphoresis, hostility, death in severe cases. Serotonin syndrome usually begins 2 to 72 hours after initiation of treatment. This resolves when the medication is discontinued. Watch for and advise clients to withhold the medication and report any of these manifestations which could indicate a lethal problem. Bruism, grinding and clenching of teeth, usually during sleep. Report bruism to the provider who might switch the client to another class of medication. Treat bruism with low-dose buspirone. Withdrawal syndrome, nausea, sensory disturbances, anxiety, tremor, malaise, and unease. Nursing actions, minimized by tapering the medication slowly. Client education, do not discontinue use abruptly, but slowly taper the dose of medication before stopping, especially with long-term use. Postural hypotension, monitor for hypotension and advise client to change positions slowly. Suicidal ideations, monitor and report manifestations of depression and thoughts of suicide. Warnings, client should notify provider if pregnancy occurs or is planned or if breastfeeding. Administer paroxetine only if the benefit to client outweighs the risk of the fetus. First trimester use can result in cardiac malformations, and use in third trimester can result in neonatal serotonin syndrome. Lactation. Use paroxetine with caution. Present in breast milk can cause agitation and anorexia. Paroxetine is contraindicated in clients taking MAOIs or TCAs. Clients taking paroxetine should avoid alcohol. Use paroxetine cautiously in clients who have liver and renal dysfunction, seizure disorders, or a history of GI bleeding. Interactions. Use of St. John's wort, SAM-E, MAOI antidepressants, or TCAs can cause serotonin syndrome. Educate the client about this combination. Avoid concurrent use. Antiplatelet medications and anticoagulants can increase risk for bleeding. Monitor for bleeding and avoid concurrent use. Administer with food. It can take up to 4 weeks to achieve therapeutic effects. Taking the medication at the same time daily promotes therapeutic levels. Taking the medication in the morning can prevent sleep disturbances.